All right, everyone. We're back, and I've got Dr. Ryan on the phone. Good morning, Dr. Ryan.
Good morning, Mark.
Well, I just heard the grim news on the county COVID-19 update with the Board of Health, but if you'll review those numbers with our listeners, I appreciate that.
Sure. So more specifically, in Clear Creek County here, we have as many cases today, active cases, as we have ever during the whole pandemic. We've had 40 cases over the last 7 days, 74 in the last 2 weeks, for some total of 620. And those numbers are going to increase as there is a slight lag in the reporting of those in the state system. Hospitalizations holding steady at 29, although that went up 3 just a couple weeks ago. Fatalities holding at 4. Our 2-week cumulative incident rate is at 759 per 100,000. And our test positivity rate is at 14.5%. All of this driven by the unvaccinated. And the lack of mask wearing, and then certain settings are driving the numbers as well. So, as far as vaccine update, we 66.3% of our eligible population has received at least one dose, and 61.7% have received 2 or one of the Johnson & Johnson. So we're moving up slowly.
Well, that's encouraging to hear that we are increasing our vaccination totals. I know that people are worried or wondering at least about breakthrough cases, and is there anything that you can tell us in regards to the, percentage or number of breakthrough cases and their associated hospitalization rate?
I can. So here in Colorado, at least 2 weeks ago, and I don't think this has changed significantly since then, 98% of all hospitalizations and their deaths were in unvaccinated individuals. 98%. That was 99% across the entire United States. So a vaccine is not 100% protective. No one has ever suggested that. There is a 5 to 10% or more of you getting COVID, but what it is really good at doing is keeping you out of the hospital or keeping you from dying. So we do have breakthrough cases, but the vast, vast majority of cases we do have, not only here in Clear Creek, but across the state and across the country, are in the unvaccinated. That is the reality. We knew there would be breakthrough cases, but the symptoms and the outcome for those individuals is far more favorable than for those who are unvaccinated.
Yeah, I wanted to touch on that subject because I think I'd like to put that into context. If the breakthrough case is just a fraction of the caseload, and that means that the caseload is being borne by the unvaccinated. So when you talk about the highest caseload that we've ever had since the beginning of COVID, that is occurring among a much smaller population of people in the county. And it's just incredible to me that you would remain unvaccinated knowing that there's, what did Mr. Wheelock say, it was 5 times the average over the course of the entire pandemic right now. And that 5-time increase in cases is occurring among 1/3 of the population.
Correct. And the primary reason for that is because most public health measures that we had in place prior were limiting that number, i.e. mask wearing across the county, limited capacity in places, et cetera, et cetera. Those are gone. What you also have now is many people who believe that they're not going to be impacted by COVID and living life without any precautions in place at all. The other thing that's changed, as you know, is the Delta variant. It is incredibly transmissible, the likes of which the original virus was not. It's on a very different scale in terms of transmissibility. So it's literally finding the pockets of unvaccinated people in this county and in this state and in this country. My biggest fear is that it's going to find the under 12 more significantly than it has to date, and all of those numbers in the under 18 are increasing across not only this state but across the country. So it's all the more reason why we need and have that mask mandate in the schools to help protect those kids who have no other way of protecting themselves than that.
Yeah, and I just heard today, I read it this morning, that Dr. Fauci is saying that maybe sometime in October there might be a Pfizer authorization for pediatric use of the Pfizer vaccine. But even at that, in best case scenario, if that, let's say October 1st, to pick a number, the earliest that any pediatrics would be fully protected would be the middle of November. So that's not looking that great. And then, of course, Moderna's behind them by a few weeks.
Right. There's a significant amount of time that it takes to vaccinate those kids, and then, as you suggest, it's a 5-week wait, right? So 3 weeks between doses and then 2 weeks full after that. So it's a ways away. But all the more reason why we need to be vigilant in what we're doing and maintain that mask mandate where it is, and that public health order that was just passed last week will go a very long way towards doing that.
I wanted to speak for just a moment about the mask mandate in the schools that was passed this last Thursday. I listened to the entire conversation, and I heard the personal attacks against you. Let me say that personal attacks have no place in any of the discourse around this or any other public issue, and that was unfortunate. But I heard a number of people talking about the vaccine as though it was something being foisted upon them in some unusual manner, and I just wanted to see if you could tick off some of the vaccines that every single child who is in school has already received, just to kind of put a little context in one more vaccine.
Yeah, there's a long list: measles, mumps, rubella, varicella. Polio, you name it. There's a very long list of vaccines that are required for your child to go to school, and that most adults in this country have received in their lifetime as well. So this is really no different. It now has full authorization, the Pfizer vaccine, just like every other vaccine that they have voluntarily taken over their lifetime and have given to their kids over their lifetime. So there's nothing being forced on them, unlike anything else has ever in history. Vaccines are highly effective. They are one of the best tools that we have in public health, not only in this country but around the world. And the level of efficacy and the impact it's had on communicable diseases has been phenomenal, to say the least, not only here but around the world. Without vaccines, we would be living in a very different world, with polio, and the list goes on and on and on and on. So these vaccines are safe. That's been proven in hundreds and hundreds of millions of people around the world. They're effective. We've seen that as well. There are no secret ingredients in the vaccines. There are no microchips. There are no magnets. There are no nothing but life-saving medicine that is readily available, free, and in abundance in this country in the form of 3 different doses or 3 different types of vaccine. So I don't know what people are talking about in terms of getting forced to do something. The masks we know are effective. That's unequivocal. The science is quite clear. Everyone from the American Medical Association to the American Academy of Pediatrics, and the list goes on and on and on and on, who fully support and endorse that mandate. It's pretty clear cut.
I don't want to get too far out in left field here, but I think this is an issue that needs to be addressed. I've heard you every week since the vaccine has been available. Every week that we've had an interview, I've heard you encourage people to become vaccinated. But in the public discourse, nationwide and locally, you hear talk of substitutes for vaccines. Ivermectin is one of them. Could you compare the efficacy of ivermectin to the, let's say, the fully authorized Pfizer vaccine?
Mark, with all due respect, there is no comparison. A vaccine is right now the only thing, whether it's Pfizer, Moderna, or J&J, or any of the other ones available worldwide, is really the only thing in combination with mask wearing that's going to protect you. There's no other over-the-counter injecting bleach into your veins. Any of that stuff is a bunch of nonsense and isn't going to protect you from COVID. The vaccines are going to protect you. They have been developed specifically for that purpose. The other things that you can find on Facebook University or any of the other social media platforms that are somehow going to save you, I don't give them any credence, and I don't give them any time of day, because they're not going to save you. They're not going to protect you. They're, in fact, more often than not going to lead to an overdose or a poisoning, because said drug or other is not actually meant for human consumption. I know lots of individuals have been peddling the idea of specific drugs that are meant for animals that are people are now taking. So there is no comparison. The vaccines are the only way out of this. That isn't my opinion. That's the opinion of every scientist in this country who is worth their weight in gold. It's the entire opinion of the world in why so many people around the world in all the countries in this world are fully supporting, endorsing, and putting that foot forward. The same way, historically, we have addressed polio and mumps and rubella and varicella, and the list goes on and on. This is no different. It's unfortunate that politics have been injected straight to the core of this, but it's why we're having the problems we are now.
Yeah, I guess that goes for vitamin D treatments as well. I won't ask you to comment on that. I think your point is well taken. I have to say, just as an aside, I find it one of the things that I can't wrap my head around that's out there is I'm not going to get the vaccine, but if I do get COVID and I am hospitalized, they can cure me with a monoclonal antibody. And I think to myself, wait a minute, that's a lab manufactured drug, if you will, just like the vaccine. And somehow that one's okay, but the vaccine is not. I don't understand that, and I won't ask you to comment on that or any other treatments. I'm just glad that we have them for the people who are foolish enough not to be vaccinated. I did want to ask you about the change in the testing availability here in Clear Creek County. I know last week I went to get to have myself tested, and typically when I go to do that, there's no cars pulled in there when I finally get around to it. This time there were 6 cars ahead of me and 8 cars behind me when I completed the free test. So it looks like there's an increase in the interest locally in testing, and you've responded to that. Tell us about it.
We saw a significant jump last week. The quarantine of one of the entire schools played a role in that in terms of demand. So COVID Check switched unknowingly to us, switched to a appointment only last week. We circled back with them, and we now have 2 additional days available in this community for free testing. It is appointments only, though, primarily because they want to know how many people are coming each day. so they don't have a situation like they had last week where there was way too many people for the actual time slots that they had available. So 2 of the days will be here in Idaho Springs, and a third day in Georgetown will be available. So that is starting this week. Testing today is in Idaho Springs. I believe the second day is Wednesday, and then the Thursday is Georgetown. But I would check our website for that specific information. And you can also find the COVID check link there.
So that's at clearcreekcounty.us. Okay, so 3 days of testing available. That's great, and of course the vaccine remains available for free at various locations throughout the community, including through the Board of Health.
Yeah, and just as a point of clarification, so it's Tuesday and Thursday in Idaho Springs currently, and they've actually extended the hours from 8 a.m. to 2 p.m., so adding 2 additional hours and an additional day each day. And then the Georgetown one, we're trying to find a site that's suitable, so still working on the logistics of that, but that will be up and running here shortly.
And that I'm sure will be posted on your website. Okay, that sounds great. And are you continuing to have vaccinations on Wednesdays?
We are. We actually held our first clinic here at our new facility last Wednesday, and our vaccine clinics are posted as well on our website in terms of when those are. As I said on the commissioner's call, we are looking at returning back to the Dumont site, particularly as we get into booster shots for individuals and having a significant number of individuals show up. So we're looking at the logistics around that, and hopefully we'll be back there sometime the end of September, the beginning of October to accommodate that.
You've anticipated my next question and regarding the booster shots. For those who are unaware of the discussion around boosters, can you just give us a brief summary?
Sure. So you may have heard a few weeks back the FDA approved a third dose for folks who are immunocompromised. That was primarily because those individuals, the second dose didn't get them up to their immunity level that you and I have, for instance. So that third dose was necessary to get them up there. This is true. This is not unique to the COVID vaccine. Polio vaccine requires 4 doses. So it all depends on the vaccine. It all depends on what disease it is trying to address. So in this case, the immunocompromised folks needed that third dose to get them up to the 80, 90 level of protection. What we're talking about now is a booster shot, and that's for individuals who are otherwise healthy, who received their vaccine 8+ months ago, who have waning immunity, which is not unique and it's not new. It's not a surprise to anybody. The vaccine, as we learn more over time, in terms of how long your immunity lasts, do we need to get this dose or shot every year, similar to the flu, or is it we get the third dose and it gives us actually really good immunity for the foreseeable future? We don't know the answer to that question yet. So the booster shot is intended for the general population, not those who have immunosuppressed issues. And so we're looking at rolling that out once the FDA approves it. They have not yet approved it. The White House put out a press release, but that doesn't make it official. The FDA actually has to approve it before we can begin administering those third doses.
And my understanding is that they're waiting on sufficient data to justify that authorization.
Correct. Just like everything the FDA does and the CDC does, they base it on science and facts and data. And so, unfortunately, sometimes you can't hurry those things. They take their time, and I see that as a good thing, that they're actually doing their job, and they're reviewing the data properly and collecting the data properly. And so that is underway, and we're anticipating that sometime by the end of September, they will have fully approved that for a third dose.
Okay, well, we'll keep our eyes on those developments as they unfold. Dr. Ryan, I wanted to say to you that late in the spring, early in the summer, when we were coming off of that that terrible winter of COVID infections, and the vaccines were going into arms at a high rate, and it looked like we were going to maybe see light at the end of the tunnel. There was a brief period of time there where we looked like we were going to make it out of this thing. And then, of course, the Delta variant took over. But when we were in that period of time, I was thinking to myself, I just want to talk to Dr. Ryan about other areas of healthcare that public health is involved in, and what initiatives you might have. And unfortunately, we just haven't had a chance to talk very much about that. We've touched briefly on some of those issues, but I'm looking forward to an opportunity to do that. I don't know if you saw this, probably you didn't. You're a busy guy and don't get much outside reading. But the New Yorker had a fascinating article about public health where was it? It was somewhere south of Mexico, one of those. I can't remember. Costa Rica is where it was, where they have actually improved, through public health initiatives, improved their life expectancy beyond that of the United States of America. It's unbelievable what they've done. Now, their health issues, of course, are unique and significant to them. Ours are different and significant to us. But I know that there's many issues that are on your mind well beyond COVID, and you're chomping at the bit to get after them.
Absolutely. In most public health issues, the solution is information and education of the broader community, right? It doesn't always take a vaccine that's necessary to address a public health issue, thankfully. There are much simpler, much more organic, if you will, ways to address them than that. And so, yeah, we're trying. We have restarted the mammogram effort here in the county. So we have now a mammogram service who comes to the Collaborative Care Center regularly and available for the general public. Which is an important thing, addressing breast cancer and addressing early detection in that. So just one example of the many things that we actively do, but have had a very difficult time moving forward or restarting because of COVID. We would like to have this be the healthiest community it can possibly be. I take my job very seriously, as do my staff, and trying to make as many services and programmatic offerings as we can to the broader community to help address our needs. And the Collaborative Care Center is a great example of that, of trying to provide a one-stop shop so that folks don't have to go down the hill every single time they need something. They can be here in our own community, and we can take care of our own in our own community. To me, that's important. And I think it's important to the broader community to have that sense of we have what we need here in our community to be healthy. There's no reason we need to go elsewhere. So, I wish we weren't working on 50-plus cases of COVID each week. I wish we were focusing on all the other things way more than we are.
Okay. Well, one of these days we'll get to we'll get beyond COVID testing and we can talk about testing for hepatitis B and hepatitis C and other vaccinations for pneumonia and vaccinations for other diseases that are so preventable that we have great tools to protect us. I'll just leave you with this, and I don't know what to say other than I think this speaks for itself. I was looking at the map of COVID global hotspots, and I looked at some of the countries that are considered to be hotspots for COVID-19, and they include Cuba, Suriname, Botswana, the country of Georgia, Mongolia, Malaysia, and the United States of America. I'm trying to think of what else we have in common with those countries other than COVID-19.
I couldn't tell you. I think, Mark, that speaks volumes. I think the fact that half of our country is still unvaccinated, when you have a life-saving free medicine available in abundance, with 3 different ones to choose from, I don't know. We're failing to do our job in this country to properly inform and educate, because clearly that is driving a lot of people's behavior is misinformation, and the consumption of it on the level that they are is beyond my comprehension and understanding as to why. We have approaching 650,000 Americans dead, with no real slowing to that in the foreseeable future, unfortunately. And it's predominantly impacting those unvaccinated folks who are unbelievers in the reality of what's going on. I don't know what to say about that. We all know the reason and rationale for it. I'm just not supposed to talk about it. So it is what it is. I hope that many of those people see the light before they become a number, a statistic, or a patient in the hospital. I spent the weekend with several people outside camping, most of which were in the medical field. And to your point earlier, one of the individuals I was with was a nurse, and she was in the ICU last week taking care of patients, and gave a patient 3 different injections through their IV, and had a discussion with this person about why they didn't get vaccinated. And they said, I don't know what's in it. There could be things in it to kill me. And she said, that's funny, because I just gave you 3 injections and you didn't ask me what was in any of those. Or do you seem to care? Like, why is it that your focus on the vaccine and what may or may not be in it is so paramount and so blinding that somehow matters, but the 3 injections I just gave you to keep you alive, you don't seem to care what I just gave you or have any questions about them. And so as she reflected on that, it was very interesting, her perspective, the nurse's perspective of that, of she's tired. She's absolutely exhausted and tired of that sense of misinformation that's out there that's being consumed on the levels. And most unfortunately, it's impacting people's lives in a negative way, which was most hurtful to her as a nurse in trying to do her job.
I'm so glad you brought that up, because as we think back on the 20-year anniversary of the terrible events of 9/11, I recall the outpouring of heartfelt sympathy and support for our first responders, all richly deserved in those days. But somehow our healthcare providers who have been on the front lines for a year and a half, dealing with what has become an unnecessary crisis, they seem to be collateral damage of the COVID-19 epidemic and our pandemic, and I just don't understand that disconnect between our response then and our response to the care providers today.
Yeah, I mean, as I stated earlier, it's unfortunate, and it's forcing, or it's driving many of them to quit in droves. And we are going to be in a world of hurt if our medical infrastructure collapses, because you may need an ICU bed, but you may not get one. And if you need one and you don't get one, the outcome is quite clear. And unfortunately, that's in the direction we're heading. and they're having to pay, $10,000 bonuses a month to keep individuals there. But eventually, that is going to lose its appeal. And when you're just absolutely exhausted, and everything else in your own personal life is going by the wayside because of your work, money doesn't really matter at that point. So that's not going to change the narrative. So I hope for the best, but what I see now is not terribly encouraging.
Well, Dr. Ryan, this has been a grim discussion that we've had this week. Let's end on the brightest note that I can think of. As I look at the number of shots going into arms, I see that there's been an uptick in the last couple of weeks. Let's hope that keeps up. And the more the merrier, because it's so effective, so productive, and if you haven't had the shot, get out there and get it.
I could not agree more, Mark. I am encouraged by the numbers and the uptick in vaccines, but we need to double or triple that to really get us out of this situation we're in now. And we'll see if that happens. I would strongly encourage everyone, but it's going to take a different type of conversation with them to get them to do it.
All right. Well, on the 20th anniversary this coming week of 9/11, when we all pulled together as one nation, let's pull together on this one as well. This time we can get the job done just like that. All we got to do is pull down that rope together.
Absolutely.
All right, Dr. Ryan, thank you for your time today. I hope to speak to you again soon, and keep up the good work. My best to all your staff.
Thanks, Mark. Be well.